Hello, everyone, and welcome back to our How To Corner. I am Dr. Will Gray. In today's episode, we're going to discuss physical therapy after open heart surgery. Before we get started, everybody at the sound of my voice, please subscribe, like, follow, press the like button, share, do all those great things, comment, ask us questions, or comment on the actual video itself, and let us know what you want to hear going forward. Now, let's get into the episode. Today's episode, we have four talking points, things we're going to cover. Pretty straightforward. What is open heart surgery? What are the symptoms and causes that leads to open heart surgery? Um, Recovery from it, and then the PT treatment for it. I think these four topics are, pretty much some topics that you get a lot of common questions about. And I think there's some answers in here that a lot of people probably don't consider or think about because they're just unaware. So my job is just to educate. So open heart surgery. Open heart surgery is called bypass surgery for a lot of people who are in the world of heart surgery. And then for us medical providers, is coronary artery bypass graft surgery. So we call it a cabbage, and requires opening the thoracic cage through the sternum. Now, this procedure is very extensive. You can have, multiple bypasses, meaning that you have multiple arteries that are compromised and need to be basically bypassed in order for the flow of blood to your heart to continue. So you won't suffer from, a myocardial infarction, which is basically a heart attack. And this requires a very extensive procedure of opening the thoracic, cage through the sternum, and that itself is very, 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 involved. Now, the causes and symptoms that lead to the open heart surgery. Sometimes people are experiencing chest pain, chest tightness, shortness of breath, neck pain, numbness in the legs and arms. And what causes those symptoms is basically the buildup of fatty deposits in the arteries, your cholesterol levels being out of whack, your good and your bad cholesterols, as well as your total cholesterol, and then hereditary and external factors like diet and activity. Let's hang on this slide for a second. There are a lot of cases where you can have symptoms of just chest tightness, and it can feel like you're trying to catch your breath. So it doesn't hurt necessarily, but you just feel weird, like your breathing is tough. And a lot of times, an actual bypass is not accompanied by an actual heart attack. Some people think that's the case. You have a little mild heart attack, go to the doctor, find out that your heart is, in trouble. Um, Blood to it has been restricted. You have a little bit, death of the heart tissue due to the lack of oxygen or blood flow to it. And then the causes, although I stated them as being pretty much, standard, buildup of fatty deposits in the arteries, cholesterol levels, hereditary, and external factors, there's some things you cannot avoid. A lot of people like for you to believe that. Sometimes you can, but sometimes you can't. Like your hereditary really plays a factor into it. And now the external things you implement or don't implement can, contribute to that risk. But sometimes you're just a little bit more predispositioned to have this diagnosis of, you know, um, arteriosclerosis or hardening of the arteries, a bit of a plaque in the arteries, which then needs to be addressed. So for any people who are pretty much conscious about, their health overall, I would definitely say, hey man, do your wellness visits, even enlist yourself with a cardiologist to be able to just do a checkup on your heart, get your ultrasound of your heart done, EKG, all those great things, and let's try to determine what stage, your heart is in. So after the surgical procedure, you have the recovery, right? That like happens. Some people are nervous. Some people who are actually going to have a heart surgery now probably are trying to wonder how that's going to go. Some people are probably already out of a phase of the surgery, and they're probably towards a certain part of it where they're in limbo a little bit, where they have some questions. The standard recovery is pretty much this: you're about 2 to 5 days in the hospital. Hospital stays have decreased over a long period of time. That's due to some financial things. We'll cover it in another video, but a lot of times, people are stable enough to go home also. So the next thing is that after you have your hospital stay, within that hospital stay, you're going to do some breathing exercises that are just trying to get you to basically breathe again. because there's a lot of quote unquote discomfort that comes with that procedure thereafter. That when you increase the actual pressure of your core or your sternum with breathing, using accessory muscles to expand, your thoracic cage or your lungs to, bring in air, since your lungs are directly connected to your actual heart. This is very important while you're in there. And then your wound care happens. They check your incision, and you should check your incision when you get home, because if it looks weird, then guess what? You need to address that. And then really realize that you have a lot of sternal precautions, not just one, a lot of sternal precautions. And you need to protect that sternum because you don't want to overload it. Something occurs that causes you to have some pain or have to return to your doctor. And make sure that you know when your follow up visit is with the surgeon. Usually they tend to have one, pretty early there after the surgery, and then they end up extending you out a few weeks or a month or so, after that first follow up, just to make sure that you're on the up and up. And then last but not least, with all that being said, you need to start physical therapy as soon as you can when you get released. Now, some people will say, wow, physical therapy is involved with recovery. Yes. For anybody who has a heart surgery, if you go home and sit in your chair and have a thought of I'm just gonna get better at home, worst thing you can do. Your heart is a muscle. It has to be worked. That's why when you have the surgery, the first day after, or you usually that right after surgery, like once you get off anesthesia, you wake up, you become, aroused. They're getting you up to move you around because your heart is a muscle. We got to make sure that the vessels that we connected to your heart, in the surgical procedure, um, is is basically, stable, and that you're okay. But even with that, that muscle has to start pumping. It has to get going. It has to get to pumping. So physical therapy is super important. Now, what does physical therapy look like in the treatment of um, a cardiovascular compromise? Um, of any kind? It looks pretty much like this. You're trying to address the cardiovascular endurance of the said person, patient, or client. And you do that through the lower extremity strengthening protocols of some kind. And when I say protocols, it's not just a standard protocol. So please don't just go find a protocol and say, hey, this is the best thing ever. Sometimes it's not just that simple. Okay. Oh my God, goodness. Somebody did some terrible editing with the spelling of words, but it's cool. Who cares? I mean, it's strengthening. We know what that is. So monitor your O2 saturation and blood pressure during the treatment. That is super important. It must be monitored. You must have this. You have to see how the person is moving oxygen throughout the tissues, and then the blood pressure. How does it look during this time? Right. And then the heart rate also, which comes with your blood pressure readings for the most part, what the heart rate is doing during the activity, and then within 2 minutes after the activity. Is it getting back down quick? Is it staying elevated or what? And then there are specialized progressions within this, by the way. This is where a lot of places lead you to believe that, you know, they have the best setups for cardiovascular recovery, therapy after open heart surgery and so on and so forth. That's not necessarily true. If I'm being honest with you, every place is a little bit different. My best bet for you is to ask people who have had the surgery, who had a great experience, where do they go, what do they do, who do they see, and you just kind of making a decision based off of those things. Now, ask people who are going to be honest. Some people don't tell the truth, but ask people who are really going to be honest with you about the providers, because that's very important. It's your heart. You want to make sure that you give it the best opportunity to be able to get back, going, so you can get back to who you are. And then here's a piece that does not get mentioned enough: wound care management. That incision, that sternum is usually cool, as far as after whether when they sew it back up and everything. But sometimes you can have some drainage coming from it. You can have some um, fluid that can collects underneath the skin initially. So you want to make sure that you don't quote unquote let that go, untouched or not, managed or mentioned. But your therapy treatment is very, 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 very important. Okay. I've had a lot of people who, mentioned to me that after their heart surgery, they never quite got back. And it's really because of fear of quote unquote what the heart is at that state. But you're totally fine. You're good. Once you leave the hospital and people have checked you out and looked at everything, you're good to go. Your biggest job is making sure that you don't sit down. You don't have to run a race that first day, but you need to be moving around because also, you're okay. I think a lot of people in the family also of the person who's experienced this particular diagnosis tend to be a little bit too kid gloves and want to hold them back and restrain them and then make sure they're okay and whatever, but they're not broken. They're actually fixed. So get them into a therapy treatment, get them going, encourage them, be a good rest support system. And then with that, they should have a great bounce back. For everybody who's made it to this point of the episode, thank you. One, two, like, three, share, and subscribe. And contact us if you have any questions concerning your recovery from open heart surgery or you're having an issue with, some quality of life stuff, since the actual procedure. Or you maybe just have some questions. We do consultations to inform people of kind of what to expect and try to relieve them of some anxiety and when it comes to the rehab portion thereafter. So if you're looking for us or looking for me, please contact us. You will be able to see our information in the description. And then also, you can find us at 3Gen Physical Therapy and Sports Science, located in Clinton, Mississippi. And until then, everyone, I hope you have a blessed one. I'll catch you in the next one.